what are your thoughts about combining robotics, AI, and Internet of Things in creating a healthcare ecosystem, smart healthcare ecosystem?
So Shruti, I smile because this is already happening. This is happening as we speak.
Yeah.
So let me make you aware of all the three things separately. IoT devices are commonplace in medicine today. So, we talk about digital stethoscopes. We've got analyzers, which are connected to the internet. We've got home health. All these are IoT devices where the data is put on the cloud and it's accessed from wherever it is. In fact, Axonic Health, where I actually am one of the, what I would say, strategic leads, we pioneer in this area. So if anyone has got an interest in saying, how can I make my hospital smarter, well, just talk with us. We do it all. But let's come to the second part. You asked me about AI and robotics. And what if I told you that this is going to be one word in the future? Because we are now actually developing self-learning robots. Yesterday, I saw a clip of a robot playing table tennis with a human.
Right.
Now, the dexterity needed to play a sport is something that I would say is amazing, because the calculations we do on our brain when we, decide on what shot, we do it subconsciously. But it's very, very complex.
Yeah.
Now, if I
Right.
can play table tennis, how long is it going to be before a robot can do at least, surgery, endoscopy, minor surgery, complex surgery? So the answer is it already can, but today what we are doing is we are trying to ensure that we do not get anything where the person can get harmed. So when you look at robotic surgery today, it is done by a human being sitting in a console. So I might sit in a console and I'll do surgery, and everything that I'm doing, it'll get replicated by the robot on the patient. But remember, this data is exactly what the robot should train itself. Once it works with 4 surgeons, the fifth time it'll say, hey, don't tell me, I now know how to move. You don't tell me. So there is a very gradual shift by involving robots to replace interventional medicine away from humans. And the areas, of course, it's very expensive right now, but areas where you need absolutely nanometer precision, like neurosurgery or spinal surgery, that will be the first area to get affected. Your run-of-the-mill test, which probably they'll be much later, because you obviously want to use where it is most impactful. These are both backed by AI. So look at an IoT device as a data generator. This IoT device is merely creating data. Look at AI as the brain, which is processing the data. And look at your robotics as arms and legs, which are converting the thought into actions. You actually replaced a human being. So by just using these three words, you've effectively told me, or you can imagine, that we are replacing human effort. Now, there is a very big anxiety. A lot of my colleagues ask me, what are humans going to do then? If what I do today is going to be done by robots and AI, then what am I good with? And I love you in human history, that has already been answered twice. And I'll take you back a little bit in history. The first time when mankind had just invented tools. Before that, humans being just dependent on plucking fruits, right? Or hunting in order to survive.
Right.
When tools got invented, the person who had the tool started killing anyone else, and it became a might is right world. Then people said, okay, now we can plant seeds and grow things. And the first generation of civilization, as we say, were farmers. But then came a revolution.
Right.
Clever people created the plow, and they suddenly realized, hang on, what I needed a month to do, the person with the plow is doing in one day. What am I going to do? So do you know what they did?
Right.
Then people said, but in order to make the plow, I will need this, and this. So we started creating more and more occupations. Someone became a blacksmith. Someone became a mason. So we evolved because we realized that that particular thing needs a lot of dependencies, and we started getting good at it. Come 2,000 years ahead, and the next revolution was when computers came in early 2000s. And there were strikes in countries like India. A lot of people who used to do accounting and stuff, they said our livelihoods are going to be disrupted by this computer. We don't want computers. I still remember everyone was convinced that once computers come in, they are going to be unemployed. What happened? Completely
Right.
reverse. We started adapting the computer, taming it to do things that we previously did not even dream about. Now, think about
Right.
what AI
Right.
is. We will just adapt and we will all start using the tools that we've created to do something phenomenal, like solving the mysteries of quantum or
Right.
solving time travel or traveling to different planets. Who knows? Today I can't even
Yeah.
dream. But one thing I'm very sure about human brain. You
Right.
cannot keep a human brain unoccupied. Full stop. So I'm very, very sure that there is no going to be no joblessness or worry. We just adapt. This has already been proven in
Right.
engineering. So about when I was a young man, we had branches of engineering. Like there was civil engineering and mechanical engineering and electronic and telecommunication. All of my friends went to US. And 10 years later, when I asked every one of them, what do you do? Everyone said software. You study civil engineering and you're doing software. There's no connection, man. Or you're doing mechanical engineering and you're doing software. Makes no connection. This is the same thing. They adapted. There was a new area. And they said, forget civil engineering. We'll just learn what this is. The same thing will happen even with healthcare. So doctors won't just do medicine.
Right.
They'll say, oh, hang on. Now I know how to do that. I'll just do that. So we will evolve.
Right.
We will actually unlock the productivity of medical minds.
Right. Right. Yeah, I think I think with this, it's like it's our human nature, right, to adapt and evolve and take whatever may come and somehow adjust and grow with it, right? So that's how we go forward. Like even in the worst case scenarios and even in the best case scenarios, that is always the result. So yeah, I always say AI is something that I don't know much about, but I don't think it's something that we should be scared about. We should learn and adapt to it and see how things will go, right? So
We
yeah,
already are
that's
doing this, Shruti. So, like I said, people who are not participating and staying away are the ones who are scared. People who started
yeah,
adapting it, they're quite comfortable. They realize, hang on, this is just going to give us the abilities that we previously never had. So, it
right,
literally, to me, is an exciting area that we all need to start looking at and adapting for ourselves.
right, right, right. Yeah, definitely. It's for us only. Like if we work with it, it's going to work for us, right? So yeah, it's all about the mindset, I guess.
Correct.
So coming to our next question, sir. Do you think integrating virtual reality and augmented reality plays a role in medical training and even perhaps in patients understanding their health better?
Absolutely. So, again, that's just data representation. To me, the words VR or AR is nothing more than actually watching a television. What we are doing is just create or offering them in a world whereby you feel immersed. These are known as immersive technologies. Now,
Right.
augmented reality is one step ahead, where you combine reality with augmentation. So, in other words, when I look at the Taj Mahal, I can see the history of Taj Mahal. That's a very interesting thing
Yeah.
because my brain will now learn about what the Taj Mahal, who built it, or I won't need the information extra, right?
Right.
So these are just
Right.
combinations. So I don't see them as anything different than what we have today. They have a huge role uh, from a perspective of offering information or letting training happen. That's already happening. Going forward, we will all actually seek our pleasures virtually or with an augmented reality because all we have to do is simulate. And like I said, they also have a role in recovery. So imagine if I actually virtually recreated a calm and a serene atmosphere, you're going to feel less afraid. If you are less afraid, your hormonal responses of the body are going to be much more favorable. Then that means that you're going to recover faster. So you can manipulate the human being by creating or changing his reality around him. So that is the
Right.
areas where we are already doing a lot of work. By the way, you'll be surprised that someone successfully carried out a complete brain surgery with virtual reality alone. No anesthesia needed. They just did it under
Wow.
local anesthetic and virtual reality. Because with the virtual reality, the anxiety levels were sorted out. And with local anesthetic, they could control the pain. I find it amazing. And, that is where there's a huge power in all these technologies. Again, it's not an area where I'm focusing, so probably I'm not the best person about AR/VR, but I'm pretty certain some of my colleagues are focusing entirely on
Right.
that area.
Wow, that is amazing. Like, imagine the possibilities. I have heard so many cases where people get addicted to pen medications, or anesthesia becomes allergic, or some side effect happens. So imagine the possibilities it could like bring if this is actually working out. So wow.
Absolutely. So let me
So
explain.
coming to our last
Virtual
question, sir.
reality can actually control your pain
Yeah.
perception. If I show you the right atmosphere, you don't feel pain. That is by activating what is known as the endorphin axis. So people are working on how you can
Right.
actually replace medical pain relief with pain relief through gadgets.
Right.
It's not perfected. Again, hypnotherapy. People are trying to see whether
Right.
hypnotherapy can allow me to do things that traditionally uses medicines and chemicals. So there's a lot of role. Sorry, I interjected, but over to your next question.
No. Yeah, wow. Yeah. The thing is, these topics are so interesting and we can talk so much about it, but we have to come to a closing end. So, yeah. So, coming to our last question, sir. Considering India's diverse socio-cultural landscape, how do you envision the ethical governance of AI in healthcare?
So the diversity of India is a real strength. The reason India stays as one country despite the diversity is because we've got a very strong value-based framework. India is probably the one of the best countries where everything human is adapted. We don't want to go and kill people or acquire more land. We are saying, listen, we just want us to stay good, do Vasudhaiva Kutumbakam, which is what our Prime Minister very proudly goes around, that the world is one family, right? So we have
Yeah.
a natural
Right.
ability to provide the ethical framework. And the reason for any ethical
Hmm.
framework has to be from a perspective of the greater good. So ethics is always a dilemma between harm versus good, right? And I'll give you a very simple example. Is it
Right.
ethical to slap a child? So a purist will say, no, 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 you should never slap your child. But hang on, if that child was likely to roam on the road and get into an accident and my slap is going to prevent that behavior, then it becomes an ethical dilemma, isn't it? And the question you have to ask
Yeah.
is there a better alternative? I'm not saying it is good to right to slap a child. I'm just saying that it's an ethical dilemma, right?
Yeah.
So putting
Right.
that context, is it right to use AI for warfare? Ethical dilemma. Because if I'm going to destroy an evil regime that is killing millions of people and I can stop it by using AI in healthcare, or sorry,
Hmm.
AI in warfare, then it's worth it. But these
Right.
questions are not as black and white. Ethical boundaries for any
Right.
technology are an ongoing challenge because there will always be
Right.
people who work in the periphery and try to cross the border. But do
Right.
you? The question was, will India have a role? The answer is absolutely. We are natural guardians of humanity. When I look at, we, I am not a Hindu, so you can kind of
Yeah.
see it from that perspective. When I look at our socio-cultural fabric in India, we talk only about human values. We are the most accommodating people. We've never tolerated
Right.
injustice. We've always been about the greater good. We've always talked about the civilization and society as a whole. So, yes, India definitely has a role for the ethical
Right.
boundary.
Yeah. Yeah. I think when it comes to ethics and philosophy and stuff like that, I think there is always it can never be black and white, right? It's always a gray area, and you have to use your head basically.
No,
So yeah.
ethics, as I said,
So
ethics, the construct to decide greater good. So let me put it this way: is it
right.
always wrong to kill a person? Let me explain this through a very simple example. I'm asking you a question: is it wrong to kill another human being?
Yeah.
Yes or no?
It is wrong. Yeah.
But then, what if the person was a murderer and you actually decided that he's a risk to the society and you hang him? That's still killing. Now, is that right or wrong? Right?
I mean,
But let
yeah,
me
it
put it
is.
this way: the
Yeah.
murder actually involved someone who was also bad. So actually, a bad person killed another bad person. Now, is it right to execute the bad person? So can you see it's multidimensional? Ethics is not unidimensional,
Right.
and it is so context
Yeah.
specific. What we always say is ethics is not about black and white ever. Ethics is about giving you guiding principles to say, as long as most of these criteria are fulfilled, go ahead. And if it is breaching certain red lines, don't do it. But you have to
Yeah.
justify that. So, like I said, everything is context driven, and so is
Right.
ethics.
Yes, yes, definitely. Thank you so much for such a wonderful session, sir. I think our listeners have got a lot of food for thought from today's session. I definitely did. Like, this was mind boggling. So, thank you so much, sir, for your precious time and your invaluable insights. Thank you.
My pleasure. Thank you so much.
And to our dear listeners, like, comment, share, and subscribe to our channel for more such interesting content. If there is some topic that you want us to talk about, do let us know, and we will definitely try to incorporate it. We will see you next Friday. Until then, stay informed, stay safe. Your health is in your hands. Namaste. Thank you.